Hello, Connecticut, and welcome to the Paid Leave podcast. The title basically says it all. I'm Nancy Barrow, and I will be delving into this new state program and how it can help you and your family. This podcast will give you information you should know about Connecticut Paid Leave and maybe just a little bit more. Connecticut Paid Leave brings peace of mind to your home, family, and workplace. Welcome to the Paid Leave podcast. World Hepatitis Day is observed each year on July 28th to raise awareness of viral hepatitis and inflammation of the liver. The theme for 2025 is Hepatitis. Let's break it down. It calls for urgent action to dismantle the financial, the social, and systemic barriers, including stigma that stand in the way of hepatitis elimination and liver cancer prevention. Millions of Americans from all walks of life are living with viral hepatitis, and most don't know they even have the virus. More than half of the people living with hepatitis don't know they have it and are unknowingly transmitting the virus to others. Here to talk more about hepatitis is Dr. Bubu Banini. Dr. Bubu Banini is an assistant professor at the Yale School of Medicine, where she also serves as the translational research director of the Metabolic Health and Weight Management Program. She also serves as the associate director of the clinical and translational core of the Yale Liver Center. Dr. Banini has board certifications in gastroenterology, transplant hepatology, and obesity medicine. Her clinical and research interests are in chronic liver diseases, specifically metabolic dysfunction-associated steatic liver disease. Dr. Banini recently co-chaired the Fatty Liver Disease Working Group established by the Connecticut State General Assembly to provide recommendations to the state on how to increase awareness and to improve care for people living with liver disease. She serves on various boards and committees, including study sections of the National Institutes of Health, committees for the American Association for the Study of Liver Diseases, and the American Gastroenterology Association, and on the National Medical Visionary Advisory Board for the American Liver Foundation. Welcome to the Paid Leave podcast, Dr. Banini.
Thank you so very much, Nancy. It's a pleasure to be here today.
Well, can you tell me about your work at the Yale Liver Center? What do you do and who do you help there?
Yes, of course. So I have been with the Yale School of Medicine for almost 5 years now. And as you mentioned, my subspecialty is hepatology, which is related to care for the liver disease. So at the Yale Liver Center, we have a number of providers. Some of them are liver specialists, others are endocrinologists, others are kidney specialists, and that is in recognition of the fact that the liver does not work in isolation. It works very closely with a number of other organs. And together, we work towards providing care for patients with liver disease and also moving forward care in terms of doing research and trying to determine new therapies or more effective therapies for liver disease.
And tell me about your involvement with the American Liver Foundation, because that's sort of how I found you.
Yes, of course. I have been involved with the American Liver Foundation for over a decade, but my initial involvement, I would say, was very peripheral. But over the past 3 years, I have come to work much more closely with them. And so really what the American Liver Foundation does is has its mission to fight against liver disease through a number of strategies. It is one of the largest organizations focused on liver disease in the United States. And it really comprises of not only healthcare providers, but patients and their advocates. And so the American Liver Foundation, or ALF for short, provides funding for medical research, provides educational opportunities for professionals, also provides advocacy for patients and their families, and really educating the public about liver wellness and disease prevention, all with the ultimate goal of improving care for liver disease.
And doesn't the liver just filter everything? So it's really important. It's an important organ.
Oh, yes, it is very important. One of the things that I like to do is I ask people to take a guess as to how many functions they think the liver can do. And a lot of times they guess much less. The
Yeah.
reality is that the liver performs over 500 unique functions.
Really?
Yes, pretty much most functions in the body, if you were to think about it, you would have the liver involved in one way or the other. It filters toxins from the blood, as you mentioned, is very much involved in clotting the blood. So if you were to have a cut, maybe you were in the kitchen and cooking and you had a little cut, the liver makes blood agents that make the blood clot so that you just don't go on bleeding profusely endlessly. The liver makes bile to digest fat, helps with digestion, and on and on and on.
Since we're here to talk about World Hepatitis Day,
Yes.
what is hepatitis?
Yeah, so when we say hepatitis, it really is a term that refers to inflammation of the liver. And in that word, it doesn't really tell you what is causing the inflammation.
Mm-hmm.
So essentially, the layman's terms is just hepatitis means inflammation. And so we are able to further characterize what the inflammation is related to by saying viral hepatitis or alcohol-associated hepatitis.
Mm-hmm.
So the World Hepatitis Day, as you mentioned, is coming up on the 28th of July. And the focus of that is on viral hepatitis. This is in recognition of the fact that there are various viruses that can lead to inflammation of the liver, hepatitis, as I mentioned. And over time, some forms of those hepatitis infections can cause long-term damage. They can cause chronic liver disease that can then put the individual at risk for end-stage liver disease and cancer. So these can really be very serious.
How do they usually get diagnosed? And is it like a simple blood test that lets you know that you have hepatitis, or is there more testing that needs to get done? And
yes, that's a great question. That's a great question. A lot of times, the patient may present with what we call jaundice, so yellowing of their eyes and skin, and that really is a signal that there's something severely wrong with the liver. And as you mentioned, typically the diagnosis is blood-based. And so the different types of hepatitis that one can get are viral hepatitis A, or Hep A for short. We can also have viral hepatitis B, hepatitis C, hepatitis D, and hepatitis E, as well as the newest form of viral hepatitis, which is hepatitis G. Viral hepatitis G was identified in 1995, so about 30 years ago. And so we do not know much about it in comparison with other hepatitis that have been around for much longer. And so some people refer to viral hepatitis G as human pegivirus 1, so HPG-V1. That is another name for that.
interesting. So, what are the differences with A, B, C, D, and E?
Yes.
And how do they affect you differently?
So viral hepatitis A typically causes acute hepatitis. It is a highly contagious, usually short-term form of viral hepatitis infection. And that can spread quickly from person to person when they consume contaminated foods or drinks.
Oh, wow.
It can cause severe inflammation to the liver, and it is typically prevented by vaccination. So a lot of times individuals may get a vaccine which combines viral hepatitis A and B, and with that series of vaccinations, it protects them from contracting the infection when they are exposed. So Despite that, unfortunately, some individuals still succumb to viral hepatitis A in the setting of not having been vaccinated. So, usually, we have about 100 deaths a year in the US related to viral hepatitis A.
Wow.
We also mentioned the other types, so viral hepatitis B and C are the most common forms of chronic viral hepatitis that we encounter. There is a large percentage of patients who will clear the infection shortly after they contract it. However, a percentage of individuals who contract it go on to develop a chronic infection from hepatitis B or C. We also have viral hepatitis D, which a lot of times we see it piggybacking on viral hepatitis B. So those who have viral hepatitis B have a higher risk of also contracting hepatitis D. And that can also lead to severe liver injury, especially in the setting of having both viral hepatitis B and D.
Yeah.
And then E, I mentioned as well, that can also be found in contaminated foods. So, typically it's shed through the stool of infected individuals. And we see that causing disease typically in young children and in pregnant individuals. I touched briefly on viral hepatitis G as well. And then human immunodeficiency virus, or HIV, can also cause severe liver disease. And we see that sometimes occurring together with chronic viral hepatitis C. So an individual may have co-infection, which means there's both HIV and chronic hepatitis C affecting the liver.
Are they all contagious?
So they are contagious in terms of the fact that, yes, they can be spread from one person to the other through different ways. As I mentioned, the subtypes of viral hepatitis A and E can be found spread through contaminated foods, contaminated drinks. Viral hepatitis B and C typically spread through coming into contact with infected body fluids. So that could be using the same household items that exposes one person's blood to the other, or through sexual contact, or using needles, for instance, that are infected, whether it is through IV drug use, or sometimes in healthcare workers where they happen to have a needle prick from a patient who may have had chronic viral hepatitis B or C, that can be spread to them through that means.
Boy, that's a little bit scary. What are some of the treatments for the different forms of hepatitis? Are there treatments that work, and can they be cured?
Yes. Absolutely. The good news is that we do have treatments, especially for the chronic viral hepatitis subtypes. So chronic viral hepatitis C can be cured with almost close to 100% cure rate. And that really was not the case, a couple of decades ago, or actually even less than that time. In a matter of a few months, they would have close to 100% cure if they are consistent with taking it as prescribed. So that is really a great success that we're able to offer that.
Yeah, and how about A and B and D? Are they more difficult to treat?
Yeah, so viral hepatitis A, typically we are able to support patients through the acute infection, supportive care, being able to, give them things like Tylenol and fluids, and helping with other symptoms that they contract. And a lot of times they're able to get through that acute viral hepatitis A infection. Again, the goal is to prevent getting it in the first place,
Yeah.
so that if we
How
are
do you
able
prevent it? That's a great segue. Like, how do you prevent it, though?
key, I think, is having access or getting that vaccine if you are able to. I mentioned that we have vaccinations that are available for viral hepatitis A and viral hepatitis B. Hepatitis C does not have a vaccine, but we do have it for hepatitis A and B. And so typically with the series of vaccinations, so for viral hepatitis A is 2 vaccinations done at, baseline and then after 6 months. And for hepatitis B is 3 vaccinations done at baseline at 1 month and then at 6 months. And that really gives you protection from contracting it. If one has not had the vaccination for protection, then you really want to be careful in terms of what you're eating, what you're drinking, and that's in the case of viral hepatitis A, because like I mentioned, it can be contracted through exposure to dirty foods and drinks. And for viral hepatitis B and C, making sure that you really are vigilant with contacts in terms of sexual contacts, in terms of in the healthcare field, being careful not to expose yourself to, contaminated needles that may cause that. Another way through which people can contract chronic viral hepatitis B and C is through tattoos. So now methods for tattoos are a lot more sanitary than several years ago, where people would sort of have tattoos done by their friends in their garage or other places. And unfortunately, sometimes the needles that I use for those tattoos are not properly sanitized. And so if that needle was used in an individual who had chronic viral hepatitis and then used on the next person, there was the chance that it could get transmitted to them. And then something else that I wanted to mention is the opioid epidemic. Unfortunately, we've heard about that ravaging our communities in the past several years. And that was another way through which chronic viral hepatitis could be transmitted from one person using a needle to inject opioids and then the next person using the same needle. So there was a period of time where we were seeing an uptick, especially in chronic viral hepatitis C related to the opioid epidemic. And thankfully, over the last year or so, it seems to be going down. So that really is something for people to be aware of.
Do some forms of hepatitis cause liver failure or liver cancer?
Yes. Really, any kind of acute viral hepatitis infection can increase the risk of liver failure. And this occurs when the infection is so severe that it really overwhelms the body and starts to shut down the liver's function. And as I mentioned, we work with a number of other specialists because we know that the liver is very interconnected with other organs. And so really in true sense of the word failure, liver failure means the liver really cannot sustain its multiple functions. I mentioned that there are over 500 different functions that the liver can do. And so in that setting, then we start to look into the possibility of the individual getting a liver transplant, because that sometimes is the only way through which the person can be saved. So that happens typically in the setting of acute viral hepatitis infection. I do want to note that sometimes when individuals have chronic viral hepatitis infection, they can be a reactivation or flare of that chronic viral hepatitis. So and we see that sometimes in those who have chronic viral hepatitis B, that the disease has been under fairly good control for several years. And then you may have a flare, which then puts them into acute liver injury, and that can lead to failure. And then in terms of chronic viral hepatitis infection, any kind of hepatitis, and going back to the beginning of the program, I mentioned that hepatitis really refers to inflammation of the liver. And so anything that continuously makes the liver inflamed, this doesn't go away. It keeps on causing inflammation day in, day out continuously, can put the liver at risk for scarring. And in the medical terms, we refer to scarring as fibrosis. And it's an attempt by the liver to regenerate and recover from that chronic insult that it keeps seeing. And as it keeps on trying to regenerate, it gets more cells, and some of them really put the liver at risk for having that scar tissue, and also put the liver at risk for becoming cancerous. So we do see individuals with chronic liver disease developing cancer. When persons have the most advanced form of scarring. So typically when you develop scarring, it starts mild, and then it can advance. And advanced scarring, which we call fibrosis stage 4, or cirrhosis, increases the risk for liver cancer. And so we are very vigilant in those individuals that have advanced scarring or advanced fibrosis. We need to image their liver every 6 months so that, God forbid, they ever get liver cancer, we can catch the cancer early, because the sooner we catch the liver cancer, the more options available to offer the patient, as opposed to when the liver cancer is caught too late. At that time, we really don't have good options for cure.
Well, this year's theme is hepatitis. Let's break it down. And it calls for action to dismantle the financial, social, and systemic barriers, including stigma. Let's talk about this. Why is there such a stigma attached to hepatitis?
I think it is due to a number of factors. So when we think about chronic viral hepatitis, hepatitis B, hepatitis C, a number of ways that people contract it, as I mentioned, is through contact with others' body fluids that have already been infected. So whether it's through IV needle use, IV drug use, or through sexual contact. And I think there is a stigma in that setting, that when someone says that they have hepatitis, then everybody may be looking at them as having engaged in one of those practices, risky, whether it's through drug use or having had unprotected sex with someone who had the disease. And so there's stigma in that way. There's also stigma in other forms of chronic liver disease, for instance, alcohol-related liver disease. So in that setting, typically we find that alcohol liver disease affects those who use moderate to high amounts of alcohol. And so the individual may not be willing to share that they have alcohol dependence, because of the stigma that comes from society in sort of looking at that person and judging them as having engaged in those habits. And so in recognition of that stigma, actually the NIAAA, which is the national association that looks at alcohol abuse disorders, has recommended using terminology that is non-stigmatizing, so that instead of saying alcoholic, we are encouraged to say alcohol associated, so that people are getting away from using alcoholic liver disease to saying alcohol associated liver disease. Instead of saying alcohol addiction, or someone is engaged in alcoholism, we would say alcohol use disorder. Again, to take away that stigma of putting almost the blame on the person, and recognizing that it's a disorder that resulted in that, just as any other disorder can really result in disease.
Connecticut Paid Leave helps offer up to 12 weeks of income replacement while you take time away from work to tend to your own serious health condition or that of a loved one. So you can take time away from work and get income replacement to diagnose or treat hepatitis. And if it's a chronic health condition, like you had mentioned, you can take those 12 weeks year after year if there are flare-ups. How does a program like Connecticut Paid Leave help your patients and their caregivers?
Yeah, I mean, it is very challenging at times to take care of someone who has a chronic liver disease. When the disease is in advanced stages or when it's very severe and individuals need to get a liver transplant, for instance, it would require the primary caregiver to take time off to care for their loved ones, because really they need almost 24/7 care and attention in that setting. So that Connecticut paid leave would give patients and also their caregivers the peace of mind that they can take the time off that is necessary to care for their loved ones, but still be able to pay their bills even while they do that.
Yeah, I know. Stress during that time is not good for you either. So I think Connecticut Paid Leave is sort of like a stress reliever in the fact that you don't have to worry about paying your bills.
Absolutely. That really, I mean, with everything that's going through, taking away that stress that comes with financial strain is a big help.
Do you encourage people to seek mental health care when they have a diagnosis of hepatitis?
Yes, I think it can be very mentally and psychologically challenging. Not everybody necessarily may need mental health support, but there are some individuals, especially those that may have had the disease for several years and ended up having complications from those conditions, might benefit from speaking to a mental health provider to get the support that is necessary. I encourage my patients that as much as they are providers that are trained to care for their body, they're also providers that are trained to care for their mind. And so patients, all their caregivers should not have hesitation about asking for support for their mind, because we know that the mind really works very closely with the body, and supporting both of those components is essential.
What would you like to see happen during World Hepatitis Day on July 28th?
I think this is a great avenue for people to learn about hepatitis, learn about viral hepatitis, learn about other types of chronic liver diseases, and build awareness. We know that more than half of people who have chronic liver disease, including hepatitis, do not know. And that's why the transmission rate can also be high, because without knowing, they don't take the necessary precaution to prevent transmitting it to other people. And so I think this is really a great avenue for education for all parties involved to try and move forward knowledge about the liver, and also try and move forward knowledge about how to care for those with chronic liver disease. I do want to put a plug in that as much as we are celebrating World Hepatitis Day on July 28th, the state of Connecticut also, in recognition especially of the fact that metabolic dysfunction associated liver disease is causing a high prevalence of chronic liver disease in Connecticut and other parts of the U.S., put together a working group for which I was fortunate to co-chair last year and earlier this year. And we put forward a set of 20 recommendations to the state as to how we can increase awareness of chronic liver disease. And Connecticut is going to have its first Connecticut Liver Health Day next April 19th, 2026. So I'm excited about that. So I think these really are avenues to increase awareness about chronic liver disease.
I want to thank my incredible guest and brilliant guest, Dr. Bubu Banini from the Yale School of Medicine, for joining me on the Paid Leave podcast. Thank you so much for taking time out of your very busy schedule to join us. I know you're really busy.
Thank you so very much, Nancy. It's been a pleasure.
For more information or to apply for benefits, please go to ctpaidleave.org. This has been another edition of the Paid Leave podcast. Please like and subscribe so you'll be notified about new podcasts that become available. Connecticut Paid Leave is a public act with a personal purpose. I'm Nancy Barrow, and thanks for listening.